Breast cancer is the most common cancer in women aside from skin cancers. The majority of those diagnosed will need to undergo treatment, which can take a toll on a woman's body. Thanks for joining us for Health News You Can Use. I'm Dan Cohen. During Breast Cancer Awareness Month, we're talking about managing common side effects of breast cancer treatment. And I'm joined by Dr. Kelly Gast, a breast medical oncologist at St. Luke's Cancer Institute. Thank you for joining us today, Dr. Gast.
Thank you for having me.
I want to start with when a patient is undergoing treatment for breast cancer. What is important for them to know about side effects potentially?
Yeah, fortunately in breast cancer, we have multiple different treatment options now, and side effects are going to be dependent on the type of treatment that you receive. So side effects from chemotherapy will be different from side effects from radiation therapy, which can be different from endocrine therapy or even targeted therapies.
You just ran through a bunch of different treatment options. Can you talk about the side effects a patient might experience with each of those treatments for us?
Sure. Fatigue can be a common side effect that we see with a lot of our treatment options. And it can be a very challenging side effect because we don't have a pill that we can use to just help alleviate that right away.
Sure.
We do have ways to kind of help manage that. There's been some good data looking at energy conservation as well as like purposeful exercise to help with that side effect.
We just talked about fatigue, but I know some other side effects include nausea and what is known as neuropathy. Can you tell us about both of those?
Sure. Nausea can be a side effect with multiple of our treatment options. With chemotherapy, a lot of times we'll use IV medications to help alleviate the nausea or prevent it. And then we also have as-needed oral medications, which can really help too.
And what about neuropathy? Can you tell us about that?
Sure. Neuropathy is a side effect that we see with some of our chemotherapy medications as well, and it can result in kind of numbness or tingling, and usually that's going to start in the tips of the fingers or the tips of the toes. Ideally, we'd like to try to prevent neuropathy as much as possible, and so sometimes we can try to cool the tips of the fingers and the tips of the toes, something called cryotherapy during the infusion, which can be beneficial. When neuropathy does develop, it's a side effect that can become permanent. So we have some medications which can help alleviate the symptoms, such as gabapentin. It's also an area of active research right now looking at ways to both treat and prevent neuropathy.
What are some ways that patients could potentially prevent hair loss if they're being treated for breast cancer?
Yes, so we see hair loss commonly with certain chemotherapy medications. And sometimes that is complete hair loss or alopecia, which is I think what a lot of us think about when we hear about that. So there are ways to try to prevent that with something called cold capping, which is essentially where you try to cool the scalp to prevent the blood flow to the scalp, to prevent the damage to the hair follicles.
I know that's one option, but what are some other treatments potentially for hair loss that are available to patients undergoing treatment?
So a lot of times with endocrine therapies, we can get some hair thinning, which is not necessarily complete hair loss. And so we can use minoxidil, which is the active ingredient in Rogaine that has topical formulation as well as a low-dose oral minoxidil has been helpful for hair regrowth.
Dr. Gast, what are some side effects from radiation therapy that you can tell us about?
Yeah, from radiation therapy, we can see patients develop radiation fibrosis, which can be development of kind of fibrous scar tissue, which can make the skin and the tissue hard and thickened. Sometimes that can lead to complications, including like decreased range of motion, impaired mobility, swelling. A lot of times we'll use our occupational therapists and physical therapists to help with some of those symptoms.
I know that this is an important time to talk about this during Breast Cancer Awareness Month, Dr. Gast. So what are some final thoughts and messages that you have for our audience as we wrap up?
Yeah, I think one of the most important things is to make sure that we want all of our patients to keep an open line of communication with their care team. Unfortunately, a lot of these treatments do have side effects, but we do have a lot of tools to help manage these. So just kind of making sure that you're keeping good communication with your care team and letting them know what's going on.
And I know a common theme this month has been talking about how individualized everyone's experience is, and I know that that's part of that equation. So
correct.
Thank you for taking the time to talk to us, Dr. Gast. We appreciate all the good work that you're doing.
Thank you.
To learn more about St. Luke's Cancer Institute's comprehensive breast cancer program and other resources for yourself or a loved one, visit stlukeskc.org/breastcancer. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks for watching. We'll see you next time on Health News You Can Use.